Begins now. Then we'll begin. Okay. Right. So if you have read and understood, considering its surgical pathology station, kindly tell me how would you address the patient's concern?
I will tell the patient that the excised mass is a cancer, and based on the histological report, it is an advanced type of cancer which can metastasize, spread to other parts of the body rapidly. So he may need further evaluation and probably chemoradiotherapy.
Okay. Can you please tell me what are the different types of stomach carcinoma that you know of?
It can be adenocarcinoma,
Yes.
lymphoma, gastrointestinal stromal tumor,
Yes.
leiomyosarcoma,
Okay.
adenoacanthoma.
Which type of stomach carcinoma is most commonly occurring?
Adenocarcinoma.
Okay. What is the prognosis of this type of carcinoma?
In advanced stages of adenocarcinoma, the prognosis is 5-year survival rate is less than 20%.
What are the risk factors which are associated with gastric carcinoma?
H. pylori infection, smoking, peptic ulcer disease, adenomatous polyp more than 2 centimeters size, chronic atrophic gastritis, low socioeconomic status, obesity, exposure to smoked food, uh, and nitrosamies, family history.
Okay, good. Can you please explain this image for me? What do you see?
This is a histological slide
Yes.
with a hematoxylin staining
Yes.
showing signet ring cells
Okay.
with,
Which can signify, yes.
which can signify carcinoma stomach.
Okay. If I ask you to describe adenocarcinoma, how would you describe it? It could be of two types, right?
It could
Can
be
you? Yes.
intestinal type and a diffuse
Or
type.
diffuse type, yes. If you can explain,
Intestinal type
yes.
is less well differentiated type of carcinoma and less malignant, while
Yes.
diffuse type is highly malignant and rapidly metastasized and poorly differentiated, usually elitist plastica type of carcinoma.
What are the other types that you know of?
Based on the morphology, we can classify
Based
into
on histology, yes.
based on histology. I will come back to
Could
that
be
question.
squamous cell carcinoma. You know the answer. Just think. Squamous cell carcinoma could be leiomyosarcoma. Yes, you told me all these before. Carcinoid, etc. Okay. Can you, if you look at the image, and can you please help me to understand the pathogenesis behind CA carcinoma stomach?
In stomach, there will be initially because of chronic inflammation, there will be intestinal metaplasia, which can later progress to low-grade dysplasia, followed by high-grade dysplasia, and develop into superficial carcinoma, and later progress to invasive carcinoma.
Can you differentiate? Tell me three differentiating features between metaplasia and dysplasia, please.
metaplasia is one change of one cell type into another, while
Okay.
dysplasia is a disorganized cell growth characterized by pleomorphism, mitotic figures, and
Give
while in
example, please give example of each type.
metaplasia, example is Barrett's esophagus.
Yes.
Dysplasia.
All right. Can you please help me and understand Borman's classification system of gastric carcinoma?
It's a morphological classification.
Yes.
It is divided into polypoidal type, fungating type, ulcerating type, and diffuse type called lentitis plastica.
Yeah, or infiltrating. Okay, can you please tell me which paraneoplastic condition is associated with gastric carcinoma?
Acanthosis nigrans,
Yes.
dermatomyositis.
All right, good. Right, depending upon the spread of gastric carcinoma, how would you classify it?
I will come back to that question.
Okay, if I can help you, maybe you can tell me if you can broadly divide it into early spread.
Okay,
and, yes, and
early and advanced type.
yes.
Early carcinoma is confined to mucosa and submucosa. Advanced is extending to muscularis propria and beyond.
Early is again further subdivided into 3 types, if you can tell me, please. There could be ulcerating, there could be infiltrating, or could be nodular or fungating. And likewise, okay, there are once you have to consider the spread or the direct spreading type of gastric carcinoma, so then there are certain signs that you notice or you come to know about. Can you tell me what is Virtue's node? And there is another sign that you can, yes, please tell me.
Virtue's node is presence of supraclavicular lymph nodes, left side.
Yes.
And there can be Trausius syndrome.
Trausius sign, yes.
It is because of the hypercoagulable state associated with the carcinoma.
Okay.
And
in case of
nodules.
Yes, good. And what is Trochanberry's tumor?
It is because of the transcoelomy site of carcinoma to the ovaries.
All right. Considering the type of investigations which have already been done in this patient, what more can you do? What more investigations can you suggest?
I would like to do the CT scan of PET scan.
Yes.
Blood investigation.
Yes.
Barium swallow.
Yes, and even just CT or abdomen. Okay, that can also be done. All right. Can you please tell me what are the complications which can arise because of as a result of total gastrectomy that you can offer to this patient?
The complications can be divided into early and late complications.
Yes.
Early complications include bleeding, infection, anastomotic leak, cholecystitis, pancreatitis. Late complications include dumping syndrome, metabolic bone disease, vitamin B12 deficiency, recurrence.
Yes. Can you describe the dumping syndrome, please?
Dumping syndrome is associated with the total gastrectomy.
Yes.
It can be early or late dumping syndrome.
Yes.
Early dumping syndrome happens in around 15 to 30 minutes after the meal. It is because of the rapid influx of high osmolar food into the intestine, as a result of which there will be influx of fluid into the intestine, causing intestinal colic, diarrhea, tachycardia, and hypertension. Late dumping syndrome usually happens after 2 to 3 hours of the meals. It is because of the high influx of high carbohydrate diet, as a result of which there will be increased insulin secretion, resulting in hypoglycemia.
All right, good. Can you suggest two alternatives, or what are the treatment that you will consider for this particular patient?
For this patient, if the gastrectomy and splenectomy is done, it means that there is a local spread.
Yes.
Hence, he may need further chemoradiotherapy.
Yes. And feeding jejunostomy.
And feeding jejunostomy.
Yeah, and maybe you can give the pain relief
Yes.
opioids and yeah. Right. Yes. More we can. Right. Okay. Good. Thanks.
Okay. Thank you.
Very good. Thank you.